Hello guys, my name is Fred and we want to learn about X-rays basic. We want to continue the introduction of X-rays basics that we have started the last time with anatomical terminology and some positioning terminology. Now we want to continue with the positioning terminology concerning the limb position terminology. The limb position terminology, we can talk about extension, flexion, abduction, adduction, pronation, supination. These are the limb position with terminology. Extension is when the angle of the joint increases. Flexion is when the angle of the joint decreases. Abduction refers to a movement away from the midline, and adductions refer to a movement towards the midline. Pronation is the movement of the hand and forearm in which the palm is moved from facing anteriorly to posteriorly, and supination is the reverse of this. So we have this limb position terminology. Here we have the image. In this image you can see the flexion and extension of the elbow. Flexion and extension of the elbow. We have also the flexion and extension of neck. We talk about flexion and extension when we are about to talk about the joint, the movement of the joint, or of the angle of the joint. Here we have flexion and extension. Next, the next image we have flexion and extension of the shoulder. We have also dorsiflexion and plantar flexion of foot. You can see it in the image. It's right here. Flexion and extension of the shoulder. It says extension is when the angle of the joint increases. Flexion is when the angle of the joint decreases. I have it right here. You can see it in the flexion of the shoulder, how the angle of the joint decreases and how the angle of the joint increases. Next, we have example of adduction and abduction of the hip and of the wrist. You can see abduction. I've said that abduction refers to a movement away from the midline. You can see it. Example of the wrist, example of the hip. Abduction refers to a movement towards the midline. You can see it. And next, you also see the image below. The images below, we have pronation and supination of hand and forearm. Pronation, we have said, is the movement of the hand and forearm in which the palm is moved from facing anteriorly to posteriorly. You can see it. You can see how the palm is moved from facing anteriorly to posteriorly. You can see it with the pronation movement, and the supination is the reverse. Simply the reverse. We also have an example of inversion and eversion of foot. Okay, now we want to talk about projection, some projection terminology. We have talked about anatomical terminology in the first video, where we have talked about anatomical position, anterior aspect of the body, posterior, lateral, medial. Positioning terminology, where we have talked about the planes of the body, median, coronal, transverse, or axial. We are also talk about the position of the patient, erect position, the cubitus position, and also the limb terminology of the limb position, and extension, flexion, abduction, adduction, pronation, supination. This terminology is very important to perform X-ray exams. To perform X-ray exams, when we want to position a patient, you have to know this terminology. You have to know this terminologies because it's very important to perform a very good X-ray. Okay, now we want to continue with the position terminology. We can describe many projection terminology. Let's define first, which is a projection. What is a projection? What is a projection? A projection is the direction of the central ray relative to aspects and planes of the body. Projection is the direction of central ray relative to aspects and planes of the body. So we have anterior posterior projection. Anterior posterior projection, AP, is when the central ray is incident on the anterior aspect, passes along or parallel to the median sagittal plane, and emerges from the posterior aspect of the body. This is anterior posterior projection. So we need to know that, to understand that, because there are some X-ray exams which need to position a patient like this in anterior posterior projection. So you have to know what it is, what it's about, to perform a good X-ray. So we have in this image an example of anterior posterior projection. Here at the right side, we have a patient in lateral position, and we can see how the central ray is directed from the anterior to the posterior side. You can see it. And we have also at the left side of the image, the left image, we have also an example of a patient. We have an axial image or transverse image. You can see how the beam, the X-ray beam, is projected toward the anterior to the posterior. Okay, next we have the posterior anterior projection. It's when the central ray is incident on the posterior aspect, passes along or parallel to the median sagittal plane, and emerges from the anterior aspect of the body. You can see it in the image, the left image, the right image. The patient is in lateral position. You can see how the central ray, the X-ray beam, is incident on the posterior aspect, and emerge from the anterior aspect of the body. Posterior anterior projection. In the axial view, at the left image, you can see the same thing, how the central ray emerge from the posterior to the anterior. You can see it. And next, we have also the lateral projection, when the central ray passes from one side of the body to the other along a coronal and transverse plane. So the lateral projection is when the central ray passes from one side of the body to the other along a coronal and transverse plane. You can see it. The central ray can pass from the left side or from the right side. It depends of the lateral position. It depends of the lateral position of the patient. It can be a left lateral or a right lateral. So it can be the right lateral of the central ray, enters the body on the left side and passes through the image receptor position on the right side. The reverse is a left lateral. So in this example, in this image, we have the right lateral projection. You can see how the central ray enters from the left side. When the central ray enters enter the body from the left side, we call it, and pass through the image receptor position on the right side, we call it the right lateral projection. And when the central ray enters the body from the right side and passes through the image receptor positioning on the left side, we call it left lateral projection. Okay. We also have oblique projection. Oblique projection is when the central ray passes through the body along a transverse plane at some angle between the median sagittal and coronal planes. It can be anterior oblique or posterior oblique, or it could be the obliqueness of the tube using beam angulation. So here you have it. You have an example of left anterior oblique projection. Left anterior oblique projection. We have this image of this patient, how she is positioned. See it. So we have here left anterior oblique projection. So when the X-ray, the central ray, when the central ray emerge from the posterior aspect, when it is incident to the posterior aspect, we call it left anterior. We call it anterior oblique. Anterior oblique. And when it is incident to the anterior aspect, is we call it posterior oblique. It's the posterior oblique projection. The posterior oblique projection. Okay, we stop here for this part, the second part of intro X-ray basics. Sometimes we used to write in some sheet what we are saying, but I will do it in the next video because there is no time for this anymore. I will just remember anything that I've said. Today we have talked about the limb position terminology, which are extension, flexion, abduction, adduction, pronation, supination. We have also talked about projection terminology, which are anterior projection, posterior, anterior projection, lateral projection, oblique projection. And in the next video, continue with the intro X-rays basics. We will talk about the basics of anatomy, of bones anatomy of the human skeleton, which is also very important to know. In X-ray or in CT scan or MRI scan, we have to know some basics of anatomy. So we will talk about it in the next video. Thank you for watching.